Yes, based on the type of inflammation, as I said before, we discussed in last class about acute inflammation and chronic inflammation. So based on that, we have to go with different types of modalities of therapeutic equipment. So usually there are different types of therapeutic equipment in order to treat the inflammation and the pain. That is the temperature modalities. Another one is electrical stimulation. So temperature modalities, we have cryotherapy, that is the ice cold type, and heat therapy, that is the superficial type or the deep type. Next one is the electrical stimulation, that is TENS and NEMS. Okay, so these are the different types of modalities we can use in physiotherapeutic equipment. The thing is that we have to decide which type of treatment we have to go for in which condition. So if you want to do vasodilation, that means in order to enhance the blood flow to have healing process means, and then you have to go heat therapy, because the heat therapy will induce your blood into blood vessel to be widened, that is vasodilation process will happen. So to enhance the blood flow, increasing the blood flow, we are having the curing process, okay, healing process over there. Okay, so this is especially for type of problem like muscle spam, stiffness of muscles, and so on, joint pain and like that. If in case of cold therapy, we have to reduce the inflammation. Okay, this is especially used for chronic inflammation. So like we have to vasoconstrict, your blood vessel has to be shrink constrict. So in that case we have to go for heat therapy. If you want to go for heat therapy, then the vasoconstriction process will be take over. For heat therapy, so cold therapy vasoconstriction, heat therapy vasodilation. So the cold therapy we can go like where you want to reduce the inflammation, or you want to reduce the blood flow, or reduce the bleeding and so on. We have to go for a cryotherapy, that is the ice pack therapy or cold therapy. So these are the difference you have to understand in which type of problem and what type of therapy we have to go with. So this is the major difference between heat therapy and the cryotherapy. Now we will see different types of cryotherapy. Okay, so why we are preferring ice in the means, it will giving a mild cooling, which is used to control the following things, that is inflammation, pain control, reduce the spasticity. This is very very important. So the free it will make your thing, the tissue to be freezed, so you don't have any sensation of pain over there. So that is the thing, reducing spasticity. The spasticity is the thing which is caused by damage to the nerve pathways, which is mainly in the control of your muscle movement, muscle movement. Okay, the nerves of brain or spinal cord, which is mainly involved in control of muscle movement, that is a spasticity. So in order to reduce the spasticity, we will have a sensation of, we will have reduced sensation of pain. So that is the reason we are going with cryotherapy, that is the cold therapy. Because of the cold, it will freeze the sensation. Okay, so we have other effects of cold on application site is that first one is the vasoconstriction, as I said before. Second one is it will reduce the rate of cell metabolism, so thereby it will decrease the need for oxygen, and it will decrease the production of cellular waste. It reduce the inflammation, reduce the pain, and reduce the muscle spasm. These are the effects of cold therapy. So let's see what is the actual mechanism is happening in cryotherapy. So cryotherapy, what we are giving very low temperature, so that is a -degree Celsius. When we are giving some stimulus like this very low temperature, immediately your vasodilation property will take place, functionality will take place, your blood vessel will get constrict. Okay, so vasodilation now it's getting reduced. So that means that blood is now started to contract, constrict. Okay, so in other cases, since it is the temperature modality, we have the thermoreceptors over the skin, so that thermoreceptors will get activated. It will give signals to the brain, that is through the nerve, especially to the spinal cord. So that spinal cord will give the signals to take over the functionality of sympathetic function. Okay, so through the sympathetic function the contraction of muscle is happening. Okay, so the muscle, even more the muscle, the smooth muscle contraction is happening, and also the vascular constriction is increasing, initiating. Okay, because of this sympathetic activity. So reducing the vasodilating, in turn we are increasing the vasoconstriction. That is the main aim of cryotherapy. Cryotherapy means cold, we have to induce vasoconstriction. So these are the all the means we are inducing the, we decrease the vasodilation and we are initiating the vasoconstriction. One is through vasodilator signal, that is histamine or prostaglandin signal. This signal will reduce the vasodilation. In other ways, we have here hemocutaneous thermoreceptors. It will give signals to the spinal cord through the nerves, specific nerve. That nerves will increase the parasympathetic activity as the instruction given by the brain. So this sympathetic activity initiate the vasoconstriction, and along with other inputs like smooth muscle contraction. So the all will, what will happen, it will decrease the blood flow. Okay, and also it will increase the blood viscosity. Okay, so that if you are giving reduced temperature, means that is cold temperature, your blood, the blood will get freezed. So the viscous, it will increase the viscosity of the blood. So the blood automatically will reduce airflow. Okay, not only through constriction the blood flow not only through constriction the blood flow is not getting reduced, and also by increase the viscosity by means of cold temperature the blood flow is also getting reduced. That is also in other means we are reducing the blood flow. So these are the reason. The thing is, one on giving cold temperature we have to initiate the vasoconstriction, thereby we have to reduce the blood flow. That is our ultimate aim. But we are trying in all other means through this mechanism. The ultimate aim of vasoconstriction and blood flow is getting reduced. So this is what happening during cryotherapy process. So in next class we will discuss what are the different types of cryotherapies out there.